Hi, I'm Ginny MacArthur, and this is the Outlook for Life podcast, which is essentially conversations around health for midlife and mature women. And with that in mind, the subject of today's podcast is my bladder. In the past, I always joked that I had a weak bladder. And even as a kid, I was always the one doing the urgent dash to the loo. Now I can remember it from way back then, but when I had my first child, everything changed. I was fit and strong and doing all of the right things. My pelvic floor was really good, as a lot of horse riders have very tight pelvic floors, which means they go through long and quite painful labors often, which was the case for me. And after I had Barnaby, I was still riding horses professionally. And I can remember the embarrassment of, let's say, a mystery stain left on somebody else's saddle. I then went on to run marathons, and the timing of my hydration was utmost. I always, whether I used a tampon and a pad, because a tampon helps to hold things up, I always wet myself. I would run marathons with coats or jumpers tied around my waist to try and minimize the embarrassment. Just hoping for the best when I got to the finish line, and being able to change quickly into different clothes at the finish line was paramount, because I couldn't sit down. I couldn't sit in a restaurant or in a car because I'd leave a wet patch. So I don't know, that I just thought I had to put up with it, I guess. It wasn't just inconvenient. It was really, to some extent, shaping my life. I planned where I walked. So, in more recent years, if I walked, I was okay in the morning if I walked first thing. But if I walked the dogs in the afternoon, I couldn't come home down a hill, because the stress incontinence of walking downhill would mean I would end up with wet patches halfway down my thighs. So I had to plan my walks. I had to plan when I drank. If I knew I was going to walk or run in the afternoon, I would try and stop drinking 2 hours before. I would have to think about what I wore. I would think about, if we were going out, for instance, if we were drinking in the evening, would I be able to dance? Could I socialize? Because often a pad wasn't enough. I found that the medical profession on the whole was fairly dismissive. And eventually, several years ago, and I pushed and pushed for this, I got to see, it was in COVID, I got to see a pelvic floor physio. And she was wonderful, because she backed up the fact that my pelvic floor was strong, because I thought somehow, all this core strength I'd done, all the Kegels I'd done, I thought somehow I wasn't doing enough and I'd messed it up on some level. We always think it's our fault, don't we? I thought it was my fault. So seeing her was absolutely wonderful. She told me to use estrogen cream, the Avestin, especially around my urethra, which I think helped a little. She also told me to use a sea sponge as a tampon and to pop it up there, because she said what my problem was, my pelvic floor was fine. It was ligaments that had been so badly damaged in childbirth. And then, of course, as you age and your estrogen levels drop and your connective tissue is not as springy or as strong, it's only going to get worse. So I found using a sea sponge tampon actually did help to support my bladder, and did help to a certain extent, right? To a certain extent, it helped with the problem. But then in 2023, I got whooping cough, and that was an absolute nightmare. I ended up having to wear incontinence pants all day, every day. It was just awful. It was a real turning point for me. And I was actually in the UK when that happened, staying with the aforementioned son. Thank you, Barnaby. And yeah, it ruined it for me. It ruined my time over there. It made it really, really tricky and embarrassing Who wants a mother staying with them who still thinks of herself as young, who's trying to get rid of incontinence pants, because she's coughing? Anyway, it was awful. It was a turning point for me. And I realized that I really didn't want to continue to live like that. So when I got home, I pushed for some proper help. And that led me to a referral for a gynecologist, who then referred me to a urogynecologist, who then did urodynamic testing on me, which was a horrible procedure where they fill your bladder, you're catheterized, and they fill your bladder and then make you jump around and do things. It's awful. But anyway, it's $1,200 worth of awfulness. But anyway, I went and did that. And he then confirmed what I already knew, that yes, there was ligament damage there. And he gave me 3 options, 2 of which were quite invasive procedures with a long recovery, which involved basically taking some tissue from your thigh or from your stomach and creating a sling to help support the bladder. And another one involved going, I think, through the rectum and using stitches, because mesh is not available in New Zealand at the moment because there were so many problems with it. So those were 2 options. And then he gave me a minimally invasive urethral bulking procedure as an option. And I thought about it long and hard, and I went back to him and I decided to give that a go. It doesn't work for everybody. It doesn't always work first time. And sometimes it's something that you do and then you end up having the full operation anyway. Anyway, the one that I chose, it's called Bulkamid, urethral bulking. And basically a gel is injected around the urethra and it helps it close more effectively. So there's less leaking under pressure of running and coughing and jumping and all of those things. I had it done a week ago last Monday. It took under an hour. Really, there was no pain associated with it. I know that I was given intravenous anti-inflammatories and stuff when I was in theatre, but I really didn't have any pain at all. The worst was I had a bit of reaction, a bit of nausea from the general anesthetic. But like I say, the whole procedure was under an hour, and a week off exercise, which is pretty hard going for me. The risks were that it might not work at all, or that it might work too well and I would have problems peeing and have to be catheterized for a little while. So we are now 10 days on, and I can say already, touch wood, fingers crossed, that for me this has been a game changer. Since the procedure, since just post surgery, I have not worn a pad. Now, I was constantly, because I'm not a pad wearing person, like I don't want to leave a trail of bloody incontinence pads behind me when I'm dead and gone, slowly breaking down in landfills somewhere, right? I mean, I have a conscience over that kind of thing. So I tried different things. I'd actually tried using reusable pads, but they just made me really sore. So I would only wear a pad when I knew I had to. So that might be going to the gym if I was going for a walk afterwards, or it might be if I was going out for the day, or if we were going out in the evening, or if we were going somewhere where I knew that I was going to be walking around. It had got to the stage after the whooping cough where I really needed a pad in all of those situations. So no pads for 10 days. It's going to save me a fortune and it's going to save the planet. So that on its own is just a win. I'm not having to plan routes around toilets or worrying about it. So there's no constant anxiety around that. And honestly, since the procedure, I've had one tiny leak after a ginormous sneeze where I probably should have gone to the loo before it anyway. And when I say a leak, it was a drip, whereas before it would have been a gush, an absolute gush. So that's it. After years of having to manage this daily, and I've had a little bit of a cold, so I have been sneezing, this just feels extraordinary. all I can say is that I wish I'd done it sooner. I've put up with this to varying extents for years and years and years. You know, my son is 35, 36 this year. So I've adjusted my life. I've minimized it. I've made jokes around it. I've had shame and embarrassment around it. But you know, the truth is you don't get a medal for tolerating something that could be treated. So if this is something that you are dealing with, don't just assume that it's a weak pelvic floor. You can be strong. You can have a strong core and still leak. It's to do with ligaments, tissue support, urethral function. All of those things matter. Number 2, get properly assessed. Ask for a referral. See a pelvic floor, physio. Go and see a urogynecologist. I'm not going to edit that out. I can't be bothered with editing, honestly. Not all incontinence is the same. You know, there's keyhole incontinence, there's different types, and treatment does depend on the cause. So you need to go and see a proper professional, get a referral, get properly assessed, and push for it. Don't get fobbed off like I did. I got fobbed off for way too long. Understand your options, and for you, that one of those options might be pelvic floor rehab. It might be that is an area that you can work on that will really help the situation. It may be estrogen therapy, which, even just the topical cream, I think that did make a difference for me. Obviously, that's if you're postmenopausal. What I did miss out was after I first had the testing, before I had the testing, but after I'd first seen the urogyne. See, I said urogyne then instead of urogynecologist. Yeah, all right. Okay. So he did give me a pessary. So he gave me a pessary, which is a horrible hard plastic device that would pop up and would hold my bladder up. And it basically stayed there. Like you took it out every 3 weeks and washed it and put it back in again. It was an awful thing. It worked when he put it in. It did help me for about the first 3 days, and then it moved. And I don't think when I put it in, I had it positioned quite right. I really didn't like it. I wasn't a fan. And when I took it out, I'm being really personal now, but when I took it out, it was a little bit smelly, and that totally put me off. And so I decided that wasn't an option for me, but it could be an option for you. And it could have worked really well, like the C-sponge had earlier on in the piece. And I know when I was a personal trainer, we would often tell women who had urinary, stress incontinence to try just popping a tampon up because it just does support things. And for you, that might be enough. So support devices, I guess. And then there's the procedure that I just had, which is basically a bulking agent, or possibly surgery. It's whatever is right for you. Don't normalize it. Remember that hydration matters. So, I deal with a lot of women who one of the things at Outlook, part of our protocol, is to drink plenty of water. It's about drinking about 30 mils of water per kilo of body weight so that you are well hydrated, because hydration affects every part of your GI tract, every part of your digestion, from your saliva the whole way through. Hydration for clear-headedness, lack of fatigue, all of those things, for lubricating your joints, all of those things. It's really, really important. So having to compromise your hydration because of stress incontinence is really bad. And actually underhydrating can irritate your bladder and make things worse. And of course, overloading at the wrong time can make things worse too. So it's about strategy, not restriction. And that's what I was living with. I guess the big thing is stop normalizing it. If this is something, if you are leaking when you run or cough or walk downhill or, any of those things, you might think it's common, But if it's affecting your quality of life, it's not something that you have to live with. If it's you, quietly managing, planning, padding, and putting up with it, go and get help. There are options. And speaking from this really recent experience, it can genuinely change your life. So go out there, talk to your health professional, and don't be scared of getting something done. If you want to talk to me more about my experience, please do message me or email me. I'm pretty much an open book. My goal with this is, I've had a lot going on lately with my hips and my bladder and my eye, and this is not a pity party. I'm only out here talking about it because my hope is it will help somebody else. And I know that there are a couple of clients that even using the strategies of the Ovestin cream and the sea sponge tampon has made a huge difference to them. And that might be all you need to do. Or it might be that you need to come into my membership and look at the section, or if you are in the membership, look at the section on Kegel exercises. Look at learning to turn your TVA or your transversus abdominis on, because that actually, it supports your lower back, but it actually goes down. It goes down through your pelvic floor. It's like a basket under there, right? So it protects everything around your lower back, but also your pelvic floor. So all of those things are really good things to do if you're not doing them already. I hope this conversation was helpful for you. I will be back with another podcast in a couple of weeks. In the meantime, have a fabulous Easter if you're listening to this on April the 1st. And this wasn't an April Fool's Day bladder joke. If you're listening to it on April the 1st, have a wonderful Easter. Enjoy a hot cross bun. Enjoy a dark chocolate hollow Easter egg to the max. And I'll speak to you in a couple of weeks' time.